Obamacare has transformed American healthcare. The changes have benefited some Americans, but the law's vast expansion of the welfare state has stuck many other Americans with the bill. Premiums are up 22%, and the penalty for not having insurance under the individual mandate can be more than $2,000. Unfortunately for many Americans, paying that penalty is still a better deal than purchasing the high-end insurance that Obamacare demands. So, until Obamacare is completely repealed and all its regulations fully rolled back, what can Americans struggling to get insurance outside of Obamacare exchanges do? Option 1, short-term health insurance. That's the closest thing out there to pre-Obamacare health insurance. It provides no coverage for pre-existing conditions, nor does it cover things like preventative care, mental health services, and maternity care. But it does allow you to buy cheap plans with less service if you don't want or need more expensive Obamacare-compliant plans. Option 2, cash clinics. These have exploded over the past few years, and these clinics take only cash or credit cards. Unlike most healthcare providers, cash clinics are upfront about their pricing, and since they have to compete with more conventional clinics, cash clinics have an incentive to keep costs down. Neither of these options are an ideal healthcare solution, but for many Americans, they're better than the Obamacare plans the government hopes to force on them. Unfortunately for consumers, you still have to pay the individual mandate fine. So, what about those who want to opt out of Obamacare entirely? They can go with option 3. So-called health shares run by faith-based groups have become popular over the past few years. In these arrangements, members pay monthly contributions that go into their share box, and when a member submits an eligible bill, it's paid out of multiple members' share boxes. In other words, health sharing functions more or less like a conventional insurance program, but it's technically not insurance. Under one organization's plan, if health share applicants are overweight or suffer from manageable pre-existing conditions, they'll be asked to agree to enroll in HealthTrack. HealthTrack enrollees pay an additional fee to work with a coach who helps them make lifestyle choices such as changing diets and setting realistic goals. Once the health goals are achieved, the participant can leave the program. Most importantly, members of Liberty HealthShare and other faith-based organizations don't have to pay Obamacare fines. Alas, that has not stopped state regulators from trying to outlaw health shares programs. These innovative opt-out options could lay the foundation for an entirely new healthcare system. Health sharing isn't much different from the mutual aid societies that existed before most of them suffered death by regulation under FDR. Two well-known mutual aid societies were the Elks Lodges and the Knights of Columbus. In exchange for monthly dues, the organization covered medical expenses and provided other benefits. These sorts of market-based innovations are the solution to Obamacare, and they'd exist more abundantly, as they did in the past, if our overzealous government didn't think it knows enough to dictate what healthcare solution is best for every single one of us, regardless of our unique circumstances. Greater freedom to choose our healthcare wouldn't lead to people dying on the street because they can't afford insurance. Instead, freedom would lead to the exact opposite. Those who are struggling financially would actually be able to afford the care they need. If you liked this video, please give us a thumbs up below and hit the links on your right to subscribe to our channel and read the full story on our website. Thanks for watching.